This week marks 40 years since the first cases of HIV were reported here in the U.S. We're taking a closer look tonight at what's progressed since then.
Advances in modern medicine have really changed the lives of those with the disease, but as News Channel 5's Olivia Michael explains, some of the challenges still remain.
On June 5th, 1981, the CDC released a report of what would be the first 5 cases of HIV, marking the start of the AIDS epidemic in the U.S.
And so now we have come from a place where there was no treatment at all 40 years ago to it being as simple as one small pill a day for many people living with HIV to manage it.
Charles Brown with My House works with thousands of HIV patients here in Nashville. He says the biggest challenge isn't finding treatment,
but there's still a lot of ignorance out there, and that's part of what we here at My House and at Nashville Cares are trying to do, which is to remove some of that ignorance about, again, how one gets HIV, how HIV is treated.
It's fighting the stigma.
I talk to a fair amount of people who are fearful of getting tested because they don't simply want to know.
That's why My House wants to increase access for HIV testing, whether it's on site, at one of their drive-through locations, or even taking an at-home test with results in at least 2 minutes.
I honestly feel that everyone, regardless of their sexual practices, regardless of their sexual attractions, should be tested for HIV every 6 to 12 months.
From 2015 to 2019, Tennessee actually saw a 4% increase of new cases. For Brown, that's not necessarily a bad thing.
Because we're doing a good job in educating and getting people into care and into treatment that previously probably were going unreported.
Today, the epidemic may be over, but for people like Brown, the battle still continues.
Until we end the epidemic of HIV.
In Nashville, Olivia Michael, News Channel 5.